Hello to all. I'm Dr. Abha Singh, and you're listening to my podcast.
Today we have with us Dr. Mary Thanuja, a dental surgeon who has experience of over 20 years in field of dentistry. She has also completed her postgraduate diploma in hospital and health management. She has been managing an outreach center established by MS Ramaya Dental Hospital in rural Bangalore for the last 17 years. In today's interview, we will try to know about her experience of treating rural populations. We will also try to know from her if she has noticed any effect of employment condition and economic condition on the health status of the patient.
This conversation is being recorded on phone, and Dr. Mary Thanuja is joining us from the very outreach center she is contributing to.
Welcome, ma'am, to today's podcast. Thank you for giving us your time and sharing your experience with us.
Thank you, Abba, for inviting me for this program. I'm honored and it will be a pleasure to explain my experience working in the rural area.
Thank you, ma'am. For listeners' better understanding, we will divide this interview into two sections. First, we will talk about your experience in managing an outreach center in rural area and what kind of patients do you get, and if you have come across any specific health problems that is related to their work condition or economic conditions. And second, we would like to hear from you about the factors that might have affected your and your co-workers' health in positive or negative way. Let's start, ma'am, then. Our first question is, ma'am, can you please tell us about your experience as a dental surgeon at Kaivara Outreach Center?
This is a long experience because I have completed a 17 years of experience in the rural area. And now if I think like why I selected the rural area to work, but I feel overwhelmed because I had done a good thing by selecting the rural area where the people were needing the treatment, where the oral part was neglected in the rural area. So I feel very happy that we are giving a treatment for people who are in need. They need the treatment, so we are helping them by giving the treatment. Starting with my experience, when I started my work, I had to develop this unit because I had to prove myself that what I have selected is correct. So starting it was a challenge to see the patients with confidently and with in the rural area you have to go to the level where they can understand because education is the problem. So that was the first challenge. Next challenge was to patient input. Patient input was less because the awareness of the dental treatment and the oral health was very less. So we had to organize few camps where we were able to tell the patients that there is an outreach center here in Kaivara. It is in a working condition where we can give you a proper treatment and also your health will be improved. The patients slowly started to come and we would by 2-3 years only we would double the patient input and our interns and all the doctors were also getting a good exposure when the patients are. And I feel it is a complete teamwork. We got a very good support from college where whichever program we were going to do, the college used to support us very nicely and very efficiently. First of all, principal, whatever programs we had gone, we used to think over it, and we used to get a positive approach. Our HOD ma'am and all the co-workers, co-staff, PGs, interns, we have got a very good support from all of them to improve the unit, and to also to give a very good, very efficient treatment to the rural area. Then we had to include few of the specialty treatment to the patients in the rural area. Then we thought it will be helpful for our PGs also. So we started doing a PG camp, which is a specialty camp where we were doing a root canal treatment, flap surgeries, oral surgery, that is infection cases, all these things. Now also it is in a continuous. It is working very nicely. And also we are involved in the few of the complete denture camps for the poor and the needy, where the people need is there. So we approached a few of the IDA groups and also our college department, prosthodontic department, and we conducted the camp, where the camp was very successful, and we are also involved in the few of the government camps which are conducted by the government, like dentalpublichealth, and also recently we had visited few of the PHs where the government camp was conducted. The first and foremost thing I tell, like my experience, if we take it as a collective, it is a best experience of my life, I will tell you, because I have seen a lot of patients and I have improved myself. It is good for me also and for patients also. They are happy with the treatment what we are rendering them, and the input has increased like anything. Sometimes we have to tell the patient, please come tomorrow, we are tired. That kind of input is there. So it's a good experience in the rural area, and I feel we have done something for the rural people.
Thank you, ma'am. We can get the sense of satisfaction of your work from your voice. And I like with this, your experience, I understand that you have started with scratches and now you have that, I think it's around 35 to 40 patients who visit to your clinic every day.
Tell our, like in the patient input also it is increased, and also the we collect very less amount, that is we collect just break-even analysis is done, and we are collecting one nominal fee. In that also we have reached to 6 digits per month. So the patient input is increased. So we are very proud to tell that.
Yes, ma'am. Thank you. So we'll move towards our next question.
Yeah.
While working here, have you ever come across patients or did any patient approach the unit whose health has been affected due to economic condition or due to their working condition?
Yeah, definitely we have seen the patient, because of their economical status, they are not able to come for the treatment where it is worsened. We have seen the patients who are coming here, who work in the factories and all small companies, where they can't give a very good care for their teeth, and few of the patients who are exposed to the chemicals also, they come here for treatment, where we have seen few stains. And one more thing is, as you have seen here, this is a rural area where the patient, where we get the patients who are in the agriculture field. There, to control their hungry, they get into the habit of chewing the betel nuts and also the twigs and all. So I have asked the patient why you are doing this habit. She told me that to control the hungry, she is keeping that in the mouth for 8 hours. So all these things, it shows because of their work, they are not able to give their proper time and proper care for their oral health and also the dental treatment.
Oh, ma'am, we can also say that to save money, they are going towards something that is not very good, a habit that is causing them, or they may cause them their life.
See, the myths are there, too much myths are there in the rural area where they come with that myths to me. Sometimes they ask me like, okay, you're telling you want to extract the tooth, I lose my eyesight, so I don't want to get it done. All those things happen, and also their main problem will be pain. You relieve the pain, they will vanish, they don't come. So that time, as a doctor, we have to counsel them, see why this pain will reduce by giving tablets, but that is not the permanent treatment. You have to come for the treatment. We had to counsel the patient a lot more, and finally they used to come for treatment. That is also there. And also the economical conditions, sometimes they will not have money for treatment, for few treatments which are costlier. So that time we had to just support them and just guide them how to get it treated immediately, and later on when they have the money they can come for the treatment, or we are giving for few patients a free treatment also.
That is so nice of you. Uh, Thank you, ma'am. Shall we move towards our next question?
Yes.
You have also experience of working in an urban setup. What difference do you see in the patient visiting a clinic in an urban area when compared to a rural area?
See, I have worked in the urban area also. The level of accepting the things will be faster in the urban area. When you are telling a particular treatment plan, the patient will be able to agree for that particular treatment plan, because they know the further it may cause problem for them. So that education, that basic education is there in the urban area. But in the rural area, their main problem, as I have told you, is pain. If the pain is reduced, they don't want to visit a doctor where the treatment will be done by like further treatments like extractions, all those things. But when you explain them, the what you tell in the rural area, you should have lot of patience to explain them, because I have seen the patients with a grade 3 mobility, they want a stabilization, like you stabilize my teeth, I don't want for extraction. So that time your part will be to explain the patient why you are removing the teeth, what is the problem over there. The explanations are more in the rural area, because we have to make them understand and go further for the treatment. That is very important in the rural area. Whereas in urban area, the people can understand better, and they because of their education level and also their what you tell towards treatment, they are forward, like the particular treatment to be done faster and very efficiently, all those things. Here in the rural area, they want a very quick treatment, efficient but less cost. That is also there. Cost is also one problem in the rural area, where in the urban area the people are ready to pay, but here they think twice to spend their money for their treatment. That is the difference.
Ma'am, so what I understand is, again, somewhere economy is playing a major role here, and basic education.
Education and economical status.
Yes.
Both will play a very important role for the dental treatment especially.
Okay. Okay, ma'am. So now moving towards our second section, I would like to ask you the question that have you ever come across any ups and downs at your workplace due to health issues related to the work environment, or maybe you have heard about it from your coworker or a relative who is a healthcare professional?
See, I'll tell you my own experience. As co-workers, we are in this unit. Our staff pattern is two doctors, two group D workers, and we are having interns every day in the work section. So it affects actually when the co-worker is not well. We'll imagine a group D worker is not well. Recently we had a few fevers, pandemic is going on, fevers are there, and when fever is there we should take care that the workers will not come for work and all. That time what happens, the work will increase to the other person. If one person is absent, the workload will get increased to the other person where they can't give their full time to the patient because they will also get tired, exertions, everything will be there. So that time the treatment will get to limitation. The treatment will not be given to all the patients whoever come here. We have to limit ourselves. So that negative effect will go to the patient by spreading the rumors. See, in the rural area, word of mouth is the best way of getting the patient. If you treat one patient properly, that patient will go and tell to 10 patients that there the treatment is very good, so we are going there. So once the negative effect comes to the patient, like I had gone to the clinic, the doctor was alone, there was no other doctor to treat. All those things, negative effect will affect the unit as well. The input may decrease for another 2-3 weeks, where the patients again they'll come to know, okay, the other worker has also come. So I feel each and every person in the unit is very important when it comes to the workplace, even the group D workers. At this section, at this point of our pandemic, where the cleaning is very important and where the sterilization is important, and the doctor will face that problem also, because to treat a patient all these things are very important. Sterilization is important, your chair cleaning is important, where we can't neglect any one of them. It is very important for the unit to work properly. The workers are healthy. Sometimes it happens, so we had to cope up. That's it.
Yes, ma'am. Moving to our last question of today. You earlier said that you and your team have started from zero and now you have reached to a state where 30 to 35 patient comes, and so on that, would you like to share about the change in working environment and how you have achieved this, that from a two-chair dental clinic to a multi-speciality unit?
Yeah, but I'll be very happy to share this experience, how we changed our rural unit from a two-chair dental unit to a multi-speciality clinic. Starting when we started, it was a basic treatments we were able to give to the patients, just extractions, restoration, scaling, all the basic we were giving. And then we had a proposal, we went with a proposal to Pushpanjali ma'am for a specialty camp. So ma'am took a initiative in creating a specialty camp where the other departments were also involved in the unit programs. Just like every 15 days we had a specialty camp. Now also it's running very successfully. where root canals, flap surgeries, and all these things were introduced. That time we found the chairs were very less because three departments were coming and we were not able to provide the chairs for them. So we thought we'll increase the input, like we'll increase the infrastructure of the dental unit. Then earlier I was a lone staff member over there. Then Dr. Karthik joined me, where we were able to give a better treatment. Like uh, we had a program, like whichever department we were interested in, Pushpanjali ma'am told us to go for a training in that particular department. So we went for that training. I had gone to the prosthodontic department, where I was given a special training for doing complete dentures and FPDs, all those things. And Dr. Karthik, he went to the endo section. So we both were trained over there for this specialty treatments. So further we improved our skills by this program, and we started doing all sorts of specialty treatment to the people over there, people in Kaivara. And we are very happy that we not only the people in and around Kaivara are getting the treatment, we are getting patients from 40-kilometer diameter, and also few patients, interstate patients are also we are getting. So like this we improved with the help of our co-staff, our Pushpanjali ma'am. She had done a lot for our improvement of this Kaivara unit, and also the other staffs in the department who had helped for us to conduct the camps and inventory management, all those things. So it's as I told you earlier, it is a teamwork as we had improved this unit.
Thank you, ma'am. It looks like with your experience, yes, we can understand that it takes a team to
Yeah.
build something.
Yeah, it is a teamwork. A lone person can't achieve all these things. It is a teamwork, and we are in a good team where we are getting a good support from all the staff, PGs, interns, everyone.
Thank you so much, ma'am. Thank you for giving us your valuable time and sharing your experience with us.
Thank you, Abba, for calling me for this program. I'm so happy that I could share my experience with you. And we'll look forward for any further programs like this. Thank you very much.
Thank you, ma'am.
This was Dr. Mary Thanuja sharing her 17 years of experience in handling an outreach center. See you all soon in our next podcast. Till then, goodbye. Take care.